Type 2 diabetes mellitus, medications that promote weight loss. Copyright Endodiabetes Limited, 2020. This video is for information purposes only. It is aimed at the general public and health professionals. Do not start any of these medications of your own accord and stop the treatment prescribed by a health professional before discussing and finding alternatives. We will talk about the classes of medications used to treat type 2 diabetes mellitus, how some of these medications can help with weight loss in patients with type 2 diabetes mellitus, and medications that are weight neutral or cause weight gain will be discussed in a separate video. Type 2 diabetes is more likely to affect people whose weight is higher than the ideal. There are genetic and ethnic predisposal factors, but in a significant number of patients, weight is also an issue. Some classes of medications used to treat type 2 diabetes have been associated with weight gain, others have been shown to be weight neutral, and some have been shown to cause weight loss. So why can treatment of type 2 diabetes cause weight gain? Before the discovery of insulin, diabetes was described as starving amid plenty. In patients with type 1 diabetes, the pancreas does not produce insulin, so muscle, fat, liver, and other tissues cannot use glucose, which is abundant in the bloodstream and higher than normal. In patients with type 2 diabetes, muscle, fat, liver, etc. are resistant to insulin, so glucose cannot be used despite a relative excess of insulin. Medications associated with weight gain. These are medications that help the body deal with excessive sugar by predominantly inducing glucose uptake by the relevant tissues. Medications associated with weight loss tend to act as appetite suppressants and also to reduce insulin resistance, or they cause a loss of glucose through urine. The medications associated with weight loss are Metformin, GLP-1 analogues, SGLT-2 Inhibitors, and one of the insulins, which will be discussed towards the end. These medications, in order to achieve the desired effect, must be taken with appropriate diet and exercise. So let's begin with metformin. It acts as an appetite suppressant. It induces a weight loss of 0.6 to 2.9 kilograms, which is 1.3 to 6 to 4 pounds in treatment-naive patients. The weight loss occurs during the first year of treatment. It mitigates the weight gain induced by some of the medications that are likely to induce it. It acts synergistically with some of the medications used to treat type 2 diabetes that induce weight loss. Metformin pros and cons. It's cheap, it's taken by mouth rather than by injection. It's used during pregnancy in some parts of the world. Some people have to stop it, however, because they cannot tolerate the side effects, which are mainly gastrointestinal upsets. It must not be used in people with advanced kidney or liver disease. SGLT-2 inhibitors. These medications have lengthy names, but we will mention dapagliflozin, canagliflozin, etc., and many more to come. All SGLT-2 inhibitors are taken by mouth. The mechanism of action is an inhibition of glucose reabsorption in the kidney. This leads to the urinary loss of approximately 70 grams of glucose daily. The daily loss of 70 grams of glucose is equal to 280 calories. 1 kilogram of fat tissue harbours 9,000 calories. SGLT-2 inhibitors and weight loss. The minimum weight loss is given in blue and the maximum weight loss is given in green. In other words, one can hope to lose 2 to 4 kilograms, which is 4.4 to 8.8 pounds, in weight 6 to 12 months after starting one of these medications. Please note these are not head-to-head data and hence cannot be used to indicate comparative efficiency. SGLT-2 inhibitors, pros and cons. They are relatively expensive. Their side effects can include urinary tract infections, recurrent genital thrush, dehydration, rarely, potentially life-threatening, euglycemic DKA. Canagliflozin has been linked to foot bone fractures and toe amputations in one of the studies done. The weight loss, although maintained, tends to tail off as there is compensatory increase in food uptake. They are taken by mouth. Most drugs in the class at present have data to show that they have survival benefits. The weight loss is related to subcutaneous and intra-abdominal fat depots. GLP-1 analogues. Exenatide is taken twice daily. Liraglutide and lixisenatide are taken once daily. Dulaglutide, Bydureon and semaglutide are taken once weekly. GLP-1 analogues weight loss. This is the most potent class of drugs when it comes to weight loss. Once again, the minimum weight loss is given in blue and the maximum weight loss is given in green. Thus, one can hope to lose between 0.8 to 5.5 kilograms, which is 1.5 pounds to 11 pounds with these medications. Once again, please note, these are not head-to-head data and hence cannot be used to indicate comparative efficiency. These, where available, will be discussed in a separate video. GLP-1 analogues, pros and cons. They are all injectable and thus require more medical and nursing time to start a patient. They are relatively expensive. They do not always achieve the desired glycemic control or weight loss. A portion of patients cannot tolerate them because of the gastrointestinal side effects. They have been linked to pancreatitis, which is an inflammation of the pancreas, and medullary thyroid cancer in rodents. They are effective if tolerated. Insulins. They are related to weight gain. However, the insulin detamir, also known as Levemir, causes less weight gain than other insulins. In people with a BMI of more than 35, it has been associated with a modest weight loss of about 0.5 kilograms, which is 1.1 pound. So to summarise, Metformin, SGLT-2 inhibitors and GLP-1 analogues are the therapies that can help with weight loss in patients with type 2 diabetes mellitus and also improve their glucose control. However, the benefit versus risk for these medications should be carefully weighed up and treatment tailored for the individual patient. Thank you for watching. Copyright Endodiabetes Limited 2020.